So in this next series of videos, we're going to be learning a little bit more about the anatomy of the skull. We're going to begin by looking at the individual bones within the skull and classifying them either as facial or cranial bones. We'll then move on to have a look at how we can use anatomical landmarks to identify whether the skull is from a male or female. And finally, we'll compare an adult skull to a fetal skull and identify sutures and fontanelles in both of these structures. So from your lectures, you know that there are 22 bones that comprise the skull. 8 of these are cranial bones and 14 are classified as facial bones. Using our coloured anatomical model, we're going to identify each of these bones. The first of these bones that we're going to identify that are classified as facial bones is the mandible. Sometimes we term this as the lower jaw bone. You can see here it directly articulates with our temporal bone. The temporal bone in this diagram is coloured in pink. The second bone that I'd like to draw your attention to that's classified as a facial bone is our zygomatic bone. In this anatomical model, it's coloured orange. You can see here that the zygomatic bone helps to form part of our eye socket or our orbit. A key anatomical landmark on this bone that I'd like to draw your attention to is known as the zygomatic process. It's this region of bone that projects posteriorly on our skull. The zygomatic process connects with the temporal process, forming the zygomatic arch. You can feel this on your face as it forms part of our cheekbone. Importantly, there's 2 zygomatic bones on our skull, one located on the left and one located on the right. Continuing with our discussion on facial bones, the next one I'd like to draw your attention to is our maxillae. You can see here that they form the majority of our facial bone structure, and they are also connected to our 2 nasal bones. Both our maxillae and our nasal bones have left and right bones under this classification. Using this anatomical model, I've pulled apart the maxillae and the nasal bones, and in doing so it has removed a lot of the other facial bones associated with this structure. So I'm going to put aside the remaining skull for a few moments and just focus on the facial bones that I have here in front of me. So I have the majority of facial bones clustered around this maxillae structure. Remembering we have the nasal bones which form the bridge of our nose, we have the maxillae which you can see forms the upper jawbone. If I turn this upside down for a moment, you can also see that it starts to form our hard palate, so that region that's located at the top of our mouth. However, the maxillae don't do this in isolation. They also present with our palatal bones, both left and right, to form the entire structure of our hard palate. We've been saying how that they have both left and right side nasal bones, maxillae and palatal bones. So I'm going to separate these into either side and look at the internal structures located within them. Now that I've isolated just the left side of our maxillae bones and the ones that they articulate with, we can clearly see the nasal bone, the palatal bone and the maxillae, which is the largest one in blue. However, we also have our inferior nasal conchae highlighted in pink, and we have our lacrimal bone in yellow. When we put the skull back together at the end of this video, you'll be able to see how the lacrimal bone forms part of our tear ducts leading to our eye socket or our orbit. So far we've discussed 13 of the 14 facial bones. The last one we have to draw our attention to is the vomer. The vomer sits nestled between the ethmoid bone. The ethmoid bone, remembering, is classified as a cranial bone. If I turn the skull just slightly to the side, you can clearly see where the vomer sits in this anatomical model. I'm just going to remove it so that you can see that it has quite a triangular shape, and it is relatively small in comparison to some of our other skull bones. Now that we've removed the 14 facial bones from our skull, we're left with the 8 cranial bones. I'm going to begin by looking at our ethmoid bone. Remembering a moment ago we removed the vomer from this region where it was wedged between 2 processes on this bone. The next bone I'd like to remove is our frontal bone. You can clearly see that our frontal bone forms part of our forehead. I quite like interacting with the anatomical model in this way because you can see how there is a really nice, well-formed cavity that seals in our brain and allows for the opening of our spinal cord through the occipital bone at the back. But continuing on, the next bone I'm going to draw your attention to is the sphenoid bone. So before we move on and look at the other remaining cranial bones, I just want to draw your attention to a few key anatomical regions associated with our sphenoid bone. Remembering from your lectures that we identified that there are greater and lesser wings associated with this bone. You can see it on this anatomical model as the greater wings projecting to the left and to the right sides away from the median line. The lesser wings are located a little bit inferior to our superior wings, and they're projecting again in the left and the right hand directions. The third and final anatomical landmark that I want to highlight on our sphenoid bone is the pterygoid process, and these are the processes projecting inferiorly away from the skull. Their role in the human body is to serve as muscle attachment sites for some of our facial muscles. So going back to our skull, we have a few more cranial bones that we have to identify. I'm not going to continue to pull this anatomical model apart because they're quite easy to see at this stage. I'm going to turn the skull on its side, and we're going to start by identifying these pink bones at the side that start to form our ear canals. Remembering that I identified this region earlier on as the temporal process, thus making this the temporal bone. We have two temporal bones, one on our right and one on our left side of our skull. Rotating it to look at the posterior surface of our skull, we see that we have a rather large bone that seals in the posterior surface of our cranial cavity. This bone is known as the occipital bone. The two remaining bones left to look at in our cranium are our parietal bones. You can see here that they form the greater or the most superior region of our skull or cranial cavity, and they both can be divided into left and right bones again. So now that we've identified the 22 bones that comprise a human skull, I've reassembled our anatomical model, and I'd just like to draw your attention to a few key bones which may be difficult to see from the surface, but we can use this anatomical model to identify them. The first bone that I'd like to identify in this three-dimensional configuration is our lacrimal bones. We spoke about these earlier on, and remember they're the yellow bones that help form part of our tear ducts. In this anatomical model, you can see a small groove that runs from the superior to inferior orientation of this bone, and this is what helps create our tear ducts. The other two bones that I just want to point out to you in this orientation is our inferior nasal concave, so the pink bones, and also the one vomer, which is separating the left and right sides of our nasal passages. I think it's important to highlight it in this orientation because it is difficult to appreciate how they exist in the human skull when they're sitting on our bench. So now we've discussed the 22 bones which comprise the human skull. What you really need to take away from this video is the names and the general locations of these bones. It is difficult to appreciate exactly how they interlock into each other without having hands-on experience, but this video is important because some people will learn not only just by looking at their textbook, by looking at this video and learning how they can incorporate into each other in our anatomical models.